Thanks very much. I'm standing in for Fenello, who's not able to be here today. So many of you will be familiar with the Saline Process ministry, which is all about equipping and mobilizing Christian healthcare workers to be witnesses of the love and reality of Jesus at the bedside in the clinics where they work. And Saline teaches people a whole variety of tools, from taking spiritual histories to raising faith flags, telling faith stories, praying with patients, how to build a spiritual referral team, and so on. And ICMDA works with other partners. IHS, International Health Services International, is the one who produces the Saline training and also translates it into different languages and coordinates the Saline partnership. But there are 8 other organizations in the International Saline Partnership, one of which is ICMDA. The other 2 big international partners are NCFI and HCFI, and there are a number of smaller groups as well who work together. So this is a collaborative and a partnership across the nations to roll out Saline training to healthcare workers. The way this is administered in ICMDA is we have a global coordinating group made up of experienced trainers, and we have a policy that the ICMDA board has agreed about how we do it, which is accessible to all of you. You just ask if you'd like to see it. And then every few months we meet with the major international groups, the chairs and the CEOs of each to plan rollout and collaboration together. There are different Saline courses, from the 90-minute taster to give people an overview, to the standard course, which is the SPWT witness training, which takes 8 to 10 hours, can be done online or in person. And then you can do the online course spot on your own or without a group if you'd like to do that. And then the 4th course is the Saline Process Training the Trainers, SPTTT, which does what it says. Trainers are of different levels. So a witness trainer can train witnesses in a SPWT session. A multiplying trainer trains witness trainers. A coach trains multiplying trainers. And the real key to growing the ministry are multiplying trainers. We didn't have any multiplying trainers in 2019, but we've now got 29 of them altogether. You can see the names here, and the ones I've highlighted in yellow are people who are also, as well as being multiplying trainers, are also field workers with ICMDA. And I know a number of you are witness trainers or WTs as well. As you know, we've got 14 regions in ICMDA, which are pictured on the slide, but we're moving to a system now of clusters where the 14 regions are grouped into 4 clusters: the Americas and Portuguese-speaking Africa, APSA, Europe, Eurasia, MENA, EEM, Sub-Saharan Africa, SSA, and then ETSO, which is East, Southeast, South Asia, and Oceania together. And the idea is that we're going to have a Saline coordinator for each of these 4 clusters, who will also be a coach and responsible for supporting the multiplying trainers. And Hedwin and Fenello have already been appointed to this role for ESO and SSA, Sub-Saharan Africa, and we're looking to appoint people for the 2 other regions which are currently vacant. There's a lot of Saline training goes on, 38 courses involving over 50 people, 500 people in just the last 6 months, first 6 months of this year. You can see most of these have happened in the ESO cluster. 22 courses have been run, different countries, most commonly Indonesia and India. There have been 10 courses in Sub-Saharan Africa, 4 in Europe, Eurasia, and Middle East, North Africa, and then a couple also in Cuba. One SPTTT is about to take place in June, and one SPWT took place in Cuba. Now, of course, there are lots of other courses running that our partner organizations like HCFI and NCFI are doing, but I've listed here just the ones that ICMDA is doing. You can see huge number. So just to finish, a few slides to put a human face on it all. These are people having finished their program and got their certificates for an SPWT in Indonesia, in in Nepal. You can see Samandra here leading that one. This was in Thailand. It just shows how saline can be used as a tool in countries that aren't fully affiliated. Thailand joined us just last year, but there was saline running there before that. This is Vietnam, a country not yet formally affiliated with ICMDA, but very successful saline program was run recently. And this one most recently was in Macau that Hedwin was involved in off the coast of China, another pioneer country for us. This is the UK. You see this very multicultural meeting here in the UK, teaching saline. This is Sulawesi in Indonesia. Again, they do it particularly well in Indonesia, particularly the photographs afterwards. This is Nigeria. Ifeanyi, one of our trainers leading this program. And then, of course, a lot of these programs take place online too. And this was an SPTTT training the trainers, people who are already have done saline and are wanting to pass it on to others. What you've received, said Paul to Timothy, pass on to others who can pass on to others. And there's a few field workers and staff in that picture as well. So what are the takeaways from this? Well, saline is an excellent tool for teaching doctors how to share faith. That's its main purpose, that patients get to hear the gospel, hear the testimony of doctors, and come to faith. But it's also an ideal first offering to groups. So groups who aren't yet fully affiliated with ICMDA, if we've just discovered some individual doctors or dentists or a small group in one part of the town, of the country, then to run a saline program there is a great way of introducing them to ICMDA and bringing them together and really blessing them as well with the training. We need more trainers all the time, particularly in the EEM and APSA regions. And great recent news is that CMDA US, our biggest national group, which had not been involved with saline recently, is now re-engaging with the saline process. And there'll be a training conference at the end of this year. And I think having the North Americans back into saline is going to be a great boost for ICMDA right across the board. And that leaves the question, might you be interested in getting trained as a witness or as a trainer, or maybe even joining our team of multiplying trainers going forward? It's a great skill to have, not difficult to learn. And we really encourage you as field workers to learn the skill, at least, very least go to a saline training event, but perhaps to become a trainer as well. Thanks, Augustine.
Thank you, Peter. What a wonderful testimony of saline and saline training. It's amazing what you just concluded by saying we know saline originated or initiated in the US many years ago. Now they've lost it, and now we're going to train them to do the saline. I know Shari is around. Please invite me to be the trainer for the saline the next time, just for me to make that joke.